Hi, I'm Elizabeth Roof at the Vanderbilt Kennedy Center. Today I'm going to be talking about prescribing medications for your child with Prader-Willi syndrome and working with your primary care physician, psychiatrist, or nurse practitioner. A lot of people wonder when they should actually consider prescribing medications or taking medications for psychiatric issues. I think a lot of it's having to think about the problem. Is this a recent occurrence? Is this something that's become worse over time? Is this something that's happening at home, at school, and across all environments that your child is in? If you get to that point, I think it's important to think about who you're actually going to talk to about this problem. So it's very important to have a good relationship with your child's pediatrician or other people that you work with and who know your child well. As far as being able to figure out what to do, a lot of it is actually being able to decide what kinds of things we can treat with medicines and what kinds of things we can't. It's really important not to focus on things like food stealing or appetite in Prader-Willi syndrome. So far, no medications have actually helped with any of those things. So we focus more on other issues that are behavioral in nature and that you've tried a lot of environmental and other kinds of techniques and they just generally haven't helped enough for your child to be functioning fully. So sometimes you can actually have a lot of these issues handled by your primary care physician. Sometimes they feel quite comfortable prescribing different medicines, and other times the issue is so complex that you have to consider a psychiatrist. There aren't a lot of people who know much about Prader-Willi syndrome. There are not a lot of psychiatrists who see a syndrome as rare as Prader-Willi syndrome, so it's all about finding someone who's willing to learn about the syndrome, know about your child, and be able to work with you as part of a team to be able to prescribe the best medications in the right dosage for your child. So what we find is that working with your insurance company, finding what your provider will pay for, who the providers are, is probably the first best step. Some psychiatrists will need a referral from your primary care physician. So again, you have to kind of know the steps. It's very important to know the steps, follow the steps, and do the homework you need to do on the front end to make sure that the appointment goes seamlessly. But you will find that it takes sometimes many months to get in to see a psychiatrist. And if you live in a very rural area, you're probably not going to have a psychiatrist that's even close to you. So again, it's all about figuring out what your resources are, where you live, and what your child actually needs. We find that just, again, looking at your insurance company, resources, and that kind of thing makes the best idea as far as being able to work effectively. I'm going to talk a little bit about working with a psychiatrist. So you get an appointment, you're not really sure what you should do. I'm going to talk about some tips about best ways to work with your psychiatrist so that you're part of a team, but you're not hindering anything or not using the best use of your time. You have very limited time. Psychiatrists and primary care physicians love patients who have notes, who have things written down, who have all sorts of information. So we're going to talk about what kinds of things you're going to need to bring to that appointment. So the first thing you need to be thinking about is what kind of problem your child is experiencing. Many parents don't know the right words, and psychiatrists and physicians often have words that are pretty technical that most families don't know. So it's important to use precise terms to describe what's going on and be able to talk about what your child is doing. Saying things like they're freaking out or they're having a nervous breakdown is not very helpful for most psychiatrists or primary care physicians. But saying things like, John is having temper outbursts on a regular basis. They've been occurring at school, at home. Things bother him so much more. They've been happening over the last 3 months and been getting worse. Those things are very helpful. You could even say, we've talked to the teacher who's been implementing a behavior chart. We've been trying to reward John for good behavior and punish his bad behavior. Those things are all very important because it shows that you have a system in place that you've been using, but again, it may not be as effective as you had hoped and that John's behavior is still having problems. So we find that actually looking at what kinds of behaviors you're having is important. How long the symptoms have occurred is important to know. Saying that they've always been bad, John has always been a difficult child, again, not really helpful for most psychiatrists. It's important to see changes in behavior and when things get worse, not just when things are bad and basically saying that John has always been this way. Temperament does matter, and your child may be a more intense child, but the idea is that these problems may be new, worsening, or happening across all of different environments that John is in a day. You may actually talk about medications you've tried in the past. Maybe John has had issues in the past with ADHD, and so you've had stimulants in the past and they worked well. But now John is continuing to have more and more outbursts. His behavior is becoming more and more uncontrollable in a classroom. But talking about medications that you've tried in the past is important, because there's nothing worse than a psychiatrist or PCP trying a medication that you've tried that either isn't working anymore or you had really bad side effects on. So writing when you started the medication, how long you were on it, what you took, doses and doses increases are so important to give to somebody as you see them. If you've tried nothing, that's also very helpful. Some people with Prader-Willi don't start medicines until they're 10, 13, 15 years old. So again, knowing what you've taken in the past, how it's worked, is such important information. So after you have an initial consult, you're going to be talking with your primary care physician or psychiatrist on a regular basis. It's important to know about follow-up. The initial visit can sometimes be quite long, 60 minutes, maybe 90 minutes, so they get all the initial information, which you should have on a form, and we'll actually be sharing some of those tip sheets with you so that you actually have it with you and you can complete it. The other thing is after you see them for the initial visit, you'll be coming in for usually 15-minute med checks. 15 minutes is not very long. Make sure you've documented changes, improvements, anything that's worsening, or any side effects. It's really important to make sure that when you have 15 minutes that you spend it wisely and you give the best information in the most precise and concise way so that they can help your child. It's also important to know that you should spend some time with the physician by yourself talking about problems. A lot of families decide that they want to share problems in front of their child, and their child with Prader-Willi can become very upset listening to people talk about their issues and things like that. So I tell people, having them talk to the child alone for a few minutes and having them talk to you alone for a few minutes is the best way to get the information across. And people with Prader-Willi generally aren't great historians about how they've been, and even if they've had behavior problems, they often minimize them. So if you're only going by what the person or the person with Prader-Willi tells you, they'll often minimize any problems they are having. So as a parent, you have to be sure that if the physician takes emails or text or any other kinds of communication, that you figure that out at the first visit and you know up front how best to actually contact that person between visits or during visits. So let's say you've been taking medicine for a while and your child has a problem that you're concerned about. Maybe their behavior is worsening, maybe there's something where they start talking about wanting to hurt themselves or doing risky things that you're concerned about. It is very important to have a plan ahead of time, to write down who you should contact, where you should go, and have that plan handy. There's nothing worse than trying to call people when your child is having a huge behavioral outburst and trying to figure out where you should go. It is so important to keep them safe. It's important for you to know where to go, and it's important for your physician to be able to follow up when you get there. If you do happen to go to an ER, there are some great resources about how best to treat a child with Prader-Willi syndrome and about food issues. Oftentimes people with Prader-Willi syndrome like going to the hospital or a doctor because they might get food. So again, be sure that they know that he should be supervised at all times and that there shouldn't be food available, and that they should be very careful about any kinds of food seeking at the ER. So psychiatric issues in Prader-Willi syndrome are pretty complex. A lot of people will have never seen anybody with Prader-Willi syndrome, and anytime you have an intellectual disability, diagnosing and treating on a regular basis these kinds of issues is much more difficult. It's important, even if you can't find anyone with experience, that they have some experience with people with developmental disabilities like Down syndrome, like autism, or any kind of other issue where they actually work with people on a regular basis who may have lower functioning or have deficits in their cognitive abilities. For many families, you're not going to find many people who fit the bill. So talking to other family members, going on websites, and maybe even contacting PWS or other family members who actually have a child with Prader-Willi syndrome would be very helpful so that you can get the information, find a provider, and work with them on a regular basis. If at any point you feel like your physician's not listening to you, is minimizing or discounting the things that you talk about, it's so important to actually either confront that issue, deal with it, or find another provider that you can work with. Having a good relationship is the first step in being part of an effective team member for your child with Prader-Willi syndrome. Some of the problems we see most commonly in younger children are attention problems. Many children with any kind of intellectual disability have issues with paying attention, staying on task, being distracted by others in the classroom, and also being able to complete and follow directions. So we find that that's one of the most common issues with people with Prader-Willi syndrome. If you have a child with attention problems, sometimes stimulants like Ritalin, Concerta, Vyvanse may help some of the issues that are going on. Sometimes they can actually make some of the problems worse. Your child can have more tics, they can become more anxious, they can actually have a hard time sleeping. So knowing the side effects, the dosage, and also how to follow the directions carefully on the medicine are very important. I always find the best thing to do is when you're in an appointment to write down every single thing, ask about side effects, ask about possible benefits, and even asking about the initial diagnosis. It's really important to know what your child is being diagnosed with, and make sure that you understand that the initial diagnosis may be different than what happens later when your child may have a more kind of complete diagnosis based on more experience and more information. So attention issues are one of the bigger issues. Some people find that non-stimulants like Strattera or other things like 10X or clonidine may actually help some of the impulse control issues better than stimulants. So again, working with your psychiatrist, your PCP, it's really important to actually get that information and realize that some of these medicines may take a little bit of time to kind of settle in and get to an effective dose. Talking to your teacher about those things, also very important. Being attentive in the classroom and being able to learn and be educated, you can actually get a lot of that information from your teacher, especially if they see changes that are positive or side effects that are negative. So talking to all the members of the team, getting all that information and sharing it with your psychiatrist is a really great way to help with attention problems in PWS. One of the issues that most parents complain about with their child with Prader-Willi syndrome is anxiety. Many children with Prader-Willi have anxiety. You see things like repetitive questions. You'll see them becoming more and more anxious and worried about schedule changes, expectations, things that they want to happen, things that they're scared to happen. All those things may be a really common behavior in Prader-Willi syndrome. We see about 40% of the people we follow actually have issues with anxiety, and we know that it's a huge issue for a lot of families. Sometimes that anxiety can become so intense that the child will literally have an outburst in order to let off some steam. So even outbursts can be kind of a symptom of anxiety. But as far as medications that work, typical anti-anxiety medicines that some people consider like Xanax or Valium or things like that are usually not a good idea for somebody with Prader-Willi syndrome. They can be okay in the moment if something is really bad happening and you want to have that medication handy to treat a quick symptom. But for long-term relief, we find things like low doses of SSRIs are the most effective treatment for people with Prader-Willi syndrome. And again, it's very important to start at a very low dose and realize that some people with Prader-Willi syndrome seem to be slow metabolizers. Therefore, they're not going to metabolize medication in the same way that somebody would who actually has another disability or is maybe completely typical. So we find that starting low, going slow is the best way to find the most effective dose to deal with anxiety and PWS, and realizing that it may be a lifelong problem, so though it may get better and you may be able to have better control, doing environmental things like schedules, visual schedules, timers, other kinds of things to kind of help contain it is a really great way to help, but medication may actually help as well because it actually makes your child feel more able to manage and cope with the anxiety that they feel on a regular basis. Anxiety with food in PWS generally doesn't change unless you have a regular schedule. They know when they're going to be fed. There's lots of kinds of consistency and structure around food. So again, if your child's anxiety is about food, it's really important to use those environmental tools. The medicines generally will not help somebody with Prader-Willi syndrome when their anxiety is generally about food. Anxiety and PWS may respond really well to SSRIs. We find typical good ones are things like Celexa and Lexapro. Some people find Prozac works well in adults with Prader-Willi syndrome. We find that some of these may have some these additional side effects like mood activation where your child becomes more agitated even at a normal typical dose for these medicines. People with UPD and imprinting mutations are more likely to actually suffer some of these side effects. So regular monitoring, regular accountability are very important for these medications. Though they work well, we find that some, again, have some unintended side effects. So if you notice any changes, it's very important to document them daily or every other day so that you get a really good idea of what's going on. Most people, when they go to the doctor, remember the last day in great detail, but may not remember that the 7 days prior to that or the 3 weeks prior to that were really quite good. So even if you've had an off day, everybody has an off day. So it's important to kind of see patterns in behavior and not actually rely on one issue or one outburst to actually kind of color your judgment about whether a medication is working effectively or whether it's working, quite well. Depression in PWS is relatively uncommon. Even though many of them are anxious, they don't actually become depressed over time, but we do find that adults with Prader-Willi syndrome are more likely to actually be depressed. Unfortunately, for many providers, these kinds of symptoms become overlooked. People with Prader-Willi already have issues with overeating and maybe sleeping too much and being generally lethargic and kind of quiet. So unfortunately, some of the symptoms of depression get missed by parents. They also get missed by providers. It's really important to notice that children with Prader-Willi will often not say that they're sad or hopeless or tearful or feeling really guilty about things, which are the most common features in general people who have depression. But in this case, we find that behavior clues are the most important things. Changes in sleeping, changes in eating, and also changes in tearfulness and irritability. People with Prader-Willi look much more angry when they're depressed than sad and hopeless and lethargic. So it's important to know those symptoms can be treated with medication, and they're usually the biggest indication that someone with Prader-Willi is depressed. Again, those low dose of SSRIs are the most important thing that we find that work well for Prader-Willi syndrome. Low doses of Celexa, low doses of Lexapro, and again, we're talking about 1/8 of a normal dose. So most of the folks that we see start with as low as 5 milligrams of Celexa or 2.5 or 5 milligrams of Lexapro. So again, knowing that the lower dose generally works well, and you can make small increases to make a difference. Again, agitation, mood activation are things to watch for. If you see changes in sleeping or eating, where they're actually getting up during the night, those can actually point to a side effect of antidepressants in depression. So a number of people with Prader-Willi syndrome are recently being diagnosed with mood disorders that are not depression. They may be things like bipolar or other mood disorders. The prevalence rates of these kinds of mood disorders like bipolar are really going up. We're not really sure why, but in the U.S. in general, children and adults are much more likely to be diagnosed with bipolar disorder. Given the fact that we do pretty extensive psychiatric interviews with the 300 patients we follow, we're really curious whether these things are real or if it's just the idea that it's very difficult to determine the kind of reactivity that we see in Prader-Willi syndrome. A person with Prader-Willi often is described as happy and easygoing until they're suddenly not. Then they're angry and irritable and very likely to have an outburst. That doesn't seem like typical mania to us, and we find that many providers in the UK and Europe feel the same way, and they're still prescribing the same medications for mood disorders that they would for depression. But again, there are things like lithium and Depakote that may actually work well for somebody with Prader-Willi syndrome. If you take these medicines, it's very important to get regular monitoring. Side effects can actually have issues with liver, and you need to know that you may have to have extra blood tests to actually make sure they're at a therapeutic level and that you're not actually having any kind of medical side effects from them. But again, some of the SSRIs that we've talked about before also work well, but again, it's very important not to get a very high dose or even a typical therapeutic dose, because again, they can actually cause some serious side effects. But again, realizing that mood disorders are relatively uncommon. If your child gets diagnosed, it's important to know that it may be a working diagnosis and maybe not a kind of a final diagnosis. Bipolar is generally genetic. The fact that more and more people are getting diagnosed but they have no family members with bipolar is kind of interesting in the fact that it just seems to be a US phenomenon and not necessarily something that is being seen across the world. It's very important with any of these medications to not expect your child to take them independently. Many children with Prader-Willi syndrome still need supervision, and even if they're adults and maybe living in some kind of group home setting, they're still going to need somebody watching them take the medicines to make sure they continue to take them as directed. Sometimes people with Prader-Willi will decide that they're better and they will stop taking their medicine thinking that now they don't need to take it anymore. It's important to have supervision and accountability and make sure that they're taking medicine as directed. You can't treat behavior problems with psychiatric medicines without taking them as prescribed. So talk to your doctor and make sure you're following the dosage, the numbers of times a day you're supposed to take them, and whether you should be taking them with food or not food. So again, those things really matter, and supervision is very, very important as a parent. Aggressive behavior in Prader-Willi syndrome is relatively common. They often act out with a lot of verbal or physical aggression when things don't go their way, and these things can happen extremely quickly, and they can happen without a lot of provocation. So for parents who deal with these on a regular basis, this is a symptom that can be treated with medication, but it's very important to know if there are diagnoses that may actually make your child more likely to have those. kinds of outbursts, or if there's environmental things. Regardless of whether your child is taking medicine, using the kind of safe approach to aggression is very important. Being able to make sure that you're safe, your child is safe, and that you don't inadvertently get too close and get in the way of a flung arm or a kicked leg, and your child generally is not trying to hurt you, but they do feel threatened when people are getting close to them when they are aggressive. So standing back at a safe distance and making sure that before they escalate, they're in a safe place is really important. Heading off these events is the most important thing. Talking in a calm voice, lowering your eyes, putting your arms down, looking non-threatening is a really great way to make sure that you can head off these. Reading the body cues of somebody with Prader-Willi syndrome, knowing when they're becoming agitated, often is the precursor to aggressive behavior. Being able to know when your child is becoming upset and redirecting that energy or dealing with it before it becomes a full-blown temper tantrum is really important. But again, medications like Risperdal work pretty well for those with Prader-Willi syndrome in very low doses. Risperdal can lead to weight gain in people who have all sorts of other disorders. But people in Prader-Willi syndrome, generally because they already have hyperphagia, we find that if they're a well-controlled environment where food is restricted and food access is restricted, they don't typically gain weight. So worrying about that while not controlling aggressive behavior, it's really important. So I think we have to look at the side effects versus the benefits to see which is the best drug. Newer atypical antipsychotics that a lot of people are seeing on TV commercials and in print ads, we have very little data to know if they work in Prader-Willi syndrome, and it's definitely more likely to have side effects. Things like agitation, more aggression, things like that are pretty common in PWS because there's so little data. So again, I think it's important to know that maybe starting with some of the older, more tried and true medications are maybe a better way to go, and if they don't work, then consider some of the newer ones, but again, at very low doses with lots of monitoring to make sure that side effects don't occur. Some people unfortunately are on high doses, and we find that mostly they have side effects and no actually positive effects. So talking with your doctor and working with them, monitoring the medication is very, very important. So psychosis in PWS is relatively uncommon. People talk a lot about how common it is, but people with Prader-Willi syndrome who get depressed can also become psychotic. It tends to be a kind of a slow move in that direction, and people often don't know the warning signs. If your child is relatively sad and withdrawn and isolated and starts to become more and more withdrawn, disheveled, not sleeping well, eating differently, things like that really seem to be the precursors to psychosis. Again, it's really important to document that, and if your gut tells you that something's different, though you can't tell exactly what it is, to bring that to your PCP or psychiatrist attention. It's really important to notice when things are different with your child, and they may not be able to talk about the symptoms, but again, noticing behavior, reading the kinds of nonverbal cues that people lead off with is really important. It's important to act quickly, it's important to get them on the right medicine, and sometimes they actually are on the right medicine, they may just need a dose increase. But if they have odd thoughts where they think people are talking about them, looking at them, they're concerned or obsessed with people that they seem to not have worried about before and seem to be talking and thinking about things that seem to be very, very repetitive, and you see that as a change, it's very important to act quickly. If your child does need to be hospitalized, making sure that the person who treats them knows that they have Prader-Willi syndrome and that food access should be limited is very important. Some people can gain 20 pounds in a week with Prader-Willi syndrome in a psychiatric hospital. Being underweight or normal weight means it's more likely that they'll determine that the child can have unlimited number of calories. And we actually have had several patients who've actually had stomach issues like rupturing or blockages from being in a psychiatric hospital because no one was actually limiting their access to food because their weight was normal. Knowing that parents are actually restricting food to keep their child healthy and at a normal weight is important to know that that's not the same thing as hyperphagia. Weight gain can happen quickly, and eating large amounts of food or sneaking food when people are not watching you really happens a lot in psychiatric hospitals. But know that that sometimes is the best place when your child is having a break. Going to the ER, being evaluated, and finding a reputable psychiatric hospital that's close to you, or not even close to you, but really reputable as far as handling people with developmental delays is a really important step. Having that information before you need it is the best way to make sure that your child will receive the best care when they are hospitalized. So So you have a lot of information about handling the most common features and psychiatric issues in Prader-Willi syndrome. It's really important to know that working as part of a team, talking to your psychiatrist, PCP, having documentation, making sure that they understand what your child is like, what their baseline is like, is really important. Knowing that you know more about your child than anyone else is very important too. Psychiatrists and physicians can know a lot about medical disorders, but you know what your child is like day in and day out. So being part of the team, making sure that you give the right information, making sure you make the best use of your time, and that you communicate effectively is very important. Though we are not psychiatrists or physicians, we actually follow 300 people with Prader-Willi syndrome and do extensive psychiatric interviews. So please work with your doctor, your physician, or your nurse practitioner, and know that they will be able to guide you and give you the best information. Any information you receive from us should only be a starting point in getting some of the help that you need for your child with Prader-Willi syndrome. So again, getting actual medical advice from your doctor is the most important step after you watch this video. Thank you.